everybody? Dr. Eric Herman, Guru Chiropractor. Peace and love to everybody out there. I'm here with my good patient, Michael. What's going on, buddy? Welcome back. Michael's been coming since, what did I say? September of 21. I think basically I was just getting started with the ring digger. I was brand new almost, right? So you were one of my first ring digger guys.
Nice.
What was going on? Do you remember what was going on back then, and how was your experience? And whatever you want to say a little bit, and then we'll roll right into the adjustment.
Yeah. So I mean, I saw your videos online. I saw Dr. Johnson's videos online, and I was seeing this technique getting done.
So you found ring digger first before you found me?
Yes. Yeah. And then I saw you on Dr. Johnson's channel, and then I was like, where's this guy from? Edison, New Jersey. That's where I used to live.
Gotcha.
And I was like, oh, this is perfect. I have to see this guy.
Awesome.
So I was, feeling locked up in my back and my neck. I definitely needed an adjustment. I was seeing chiropractors before that were just not, they were helping. It just didn't solve the problem. And that first ring dinger I had, it's pretty mind-blowing. If you never had it before, I had it done, and it held for a long time. But life and stress and different things happen. And
we were looking at your chart. I think it was one ring dinger, and then a year and a half till you came back.
Yeah, I was busy, but now I came back because I had problems with my neck again.
Right.
Yeah.
Right. All right, cool. Well, welcome back. You've been coming back now about like once every couple months for through. I think you've had 4 or 5 visits in 23.
Yeah.
You got a little neck stuff, you little jammed up in the upper neck, side. And the upper back too is all tight, right? Yeah. So we were talking off camera too. I see people come to me anywhere from telling me I have 0 symptoms, doc, and I just want to tune up, or I'm an athlete and I have a big match or a big tournament coming up, and I just want to get tuned up so my body performs at its best. I call that a performance enhancement adjustment. You don't have to have symptoms for this to benefit you. But I do have it from that spectrum all the way to people crawling in here, and everybody in between, right? So just because you don't have any pain necessarily, that doesn't mean that this wouldn't benefit you. I'm not trying to sell you if you don't have pain, but when you're jammed up, you could have no pain, but it will reduce your body's ability to perform at its best. It will lower your body's physical potential, right? So if you're looking to have the best potential, this can help you, right? And it also prevents arthritis, slows all that stuff down, keeps your posture better, all that kind of stuff.
Posture.
So we're going to roll in today. We're going to check out that neck a little bit, see if we could give you a good release. And I'm going to check everything else anyway, because a lot of times there's things brewing that the patient is not even aware of, but I could find it with my exam, and we could head it off at the pass, so to speak. We could nip it. We could get in front of the big pain and get rid of it before it gets worse. And I think that's cool. I think that's a very valuable thing to do for people. An ounce of prevention is worth a pound of cure. Did you ever hear that before? I didn't come up with it, but I think it's profound. So anyway, let's roll right in. You ready to go? Ready. Go ahead and face down on the table. I'm going to do a couple orthopedic tests, a couple chiropractic examination stuff, just to kind of narrow down a game plan for how I'm going to adjust this guy. And I'll tell you guys what's going on as I see. So first, I like to check posture from this position. And what I'm seeing is you got a torque in your body. Everything's twisted to the left. I don't know if the camera can pick it up, but the shoulders are going like this, and the hip, not as much, but the hip is also subtly shifted to the left. So are you like a side sleeper? Sometimes when you have like the whole body twisted to one side, it's either from sleeping all night in one direction, or from it's okay. Or from doing something repetitively to one side over and over and over again. Anyway, the good news is getting adjusted will neutralize all that. We'll get you back, hopefully, if I do a good job, should get you back to a good solid posture. Now I'm looking down at the lower back, and your right hip is also high because your right heel is about an inch shorter than your left heel. Now, I know we talked about this before, but for the camera's sake, for the people out there watching, you don't have an actual short leg, right?
No.
Because a lot of people come in from other chiropractors and they think their leg is short because they find this kind of pattern going on, but they don't, the chiropractor, apparently the other chiropractors don't educate them to what's going on. So they think their actual leg is short. Very rarely is that the case. Usually what's going on is the short side is way tighter and it's pulling it up and it's stuck that way. So your pattern in your pelvis is you got a torque to the left and a high right hip. And it's kind of stuck that way. Now, walking around like that is not ideal, and that'll eventually, unchecked and uncorrected, can cause big problems. Your joints will wear out quicker, and they'll get irritated faster, and they're weaker than they should be. So, what do you think? Should we leave it that way, or should we fix it? Now, just a point too, you didn't complain at all today about anything happening in your lower back, right? No. So you really don't have that many symptoms. So the point I was saying before, we're having a noisy video today. The point I was saying before is, just because you're not symptomatic is not a guarantee that you don't have problems brewing. So it's always good to come in for a checkup because the doctors can find stuff early. So now I'm going to bend up your knees. Bend, bend, bend. Let me know if that gets tight in your lower back. Does it make your lower back tighter?
Only on the right side a little bit.
Yeah, that's the higher side and that's the tighter side. So remember what that feels like because we're going to check it later to see if it got any better than it is now. Now we're going to check the integrity and the range of motion of your sacroiliac joints, which are the joints that connect your tailbone to your hip bones. So I'm going to push a little bit on your tailbone. Start with the left. Don't bend it. Yup, lift it up as high as you can. All right, went up pretty good. Drop it. Did that feel like it caused any abnormal pain or pulling?
No.
All right, do the right side. Lift. Excuse me. Okay, and down. Well, I saw a little something. Hopefully the camera picked it up. But how did that side feel compared to the other side?
It felt a little restricted on like the finger right about here.
Yeah, it didn't go up quite as high on this side. So definitely more jammed and more tight on this side. So we're going to put a little more emphasis on this side to adjust, to get that released. And even when I push, can you feel the difference in pressure between here and there? Yeah, way tighter here. Is it sore when I poke? Or just
not really, but you can feel pressure.
Pressure. Good. Sometimes it gets sore too, which would mean it's jammed and inflamed. But today it doesn't seem like it's too inflamed. That's probably why you don't know about it yet. All right, coming up the spine. Got some little bit of tightness here in the what's called the thoracolumbar junction where it connects. Now, right when I start getting about here, it's tight. Can you feel it? Pretty rigid here between the shoulder blades. That needs to get some release. That's definitely compressed. And then lower neck on the right is way tight. Is that sore? Yeah. Not as bad on this side? Feel the difference? Yeah. So this is the cervical thoracic junction where the neck transitions to the shoulders, and that's a hot spot for problems. And then you were saying your upper cervical, your upper neck on the right was jammed?
Yeah.
Yeah. So that makes sense. The whole right side for you. Right, right, and right. There's the big problems for this guy. Here, here, and here. So either we cut off the right and put a new one on, or we fix the one you got. What do you think? What should we do? What should we do, Theo? Cut off his right side and give him an Android right, or should we fix what he's got?
Fix it.
Good job. All right, I'm going to do my best. Cool. All right. So I'm done with the exam. Nothing showed up to make me nervous about safety, and I'm ready to go if you are. Okay. So I'm going to stretch out a little bit first here, like I always do. Kind of like warm up the muscles, loosen things up a little bit before we do the big adjustments. I just feel like it helps me release better. And nobody complains. Everybody likes the massage. Just about. All right, we're going to use the thumper, do a little more massage to loosen up the muscles. Tickle? Does it tickle same thing on this side?
A little bit.
Or different? Is it different?
It's less ticklish, more ticklish on the left.
Yeah. So here's a point too. This is the involved side. This is the problematic side, right? What I see a lot is people complain that it's ticklish on the involved side. It's really hypersensitive because it's not right there, and the nerves and the tissue get hypersensitive, more sensitive than normal when there's a problem. So it feels like it's ticklish to you, but it's really hypersensitive. Do you ever notice you can't tickle yourself? Do you ever notice that? Why? Why is that? What's the reason? Because you know you're doing it. But if you know somebody else is doing it, it still bothers you. But why, when you put your own hand on the same area, it doesn't tickle? Isn't that interesting? These are things I think about at 3 o'clock in the morning when I wake up and I can't go back to sleep. If anybody out there wants to comment on the video and give me the answer about why you can't tickle yourself, please. We'll have a little contest. Do-do-do. Good. Good. Like I said, just a little warm up. I don't even consider this like a major part of the treatment. It's like more like prep for the big stuff, but some people say they feel great afterwards. Yeah. All right, when you're ready, big guy, come on up on your feet, no rush. And we're going in the back room for the ring dinger. The world famous New Jersey ring dinger. Hands up this way. I gotta feel where the hips are. Top of the hips gotta come down a little bit. Slide right there, perfect. Good. Okay. Now, my table's been making weird noises the last few days.
Okay.
Hear it squeaking?
Stop treating it like that. Too rough with it.
No, I can't. No, I can't. I keep getting like 400-pound linebacker guys coming to get treated. Slide up a little bit. You're a little low now. Right there's good. Now we have to pin you in pretty tight here above your hip bones, and this is super important for this treatment to get a full release all the way down. We anchor you at the hips. So when I pull your neck, the body stops short and the force goes bing. And that's why he calls it the ring dinger. Do you know why?
Not really.
You ever see at the fairs and the carnivals where you try to hit the bottom and ring the bell at the top of the pole, like with the sledgehammer? Mm-hmm. Well, when he's here, he's visualizing ringing the bell, and the bell is getting it all the way down to the lower back, like getting the full release.
Okay.
So that's the story of why he named it ring dinger, because people say, "What the hell does ring dinger mean?" You know.
Yeah.
But once you understand, it makes a little bit more sense. Anyway, it's going to be tight. It's better than ring finger, and it's better than humdinger. How about that? Is that too tight?
Feels good.
Good man. Let me get your hands back to me. This is not the treatment. Just making sure you're pinned up at the hips. Good. Now the towel goes around your neck, but really it grabs the back of your skull and your jaw and pulls like that. But my hands are way too small to get a good enough pull. So the towel gives me super pull strength. I gotta re-roll it. Good. Okay, lift up your neck. Okay, come on down. Good. I know you know this because you've been here a while, but for the sake of the camera, most important for you is keeping your teeth together, but don't bite hard. Just keep them closed so when I pull, you're not banging teeth, chipping teeth, biting your tongue off. We don't want any of that happening today. Not the day before Christmas. I'm not doing any first aid today. Okay, you ready to go, bro?
Ready to roll.
Okay. Just stay relaxed. Breathe through your nose. Do me a favor, wiggle.
Oh, oh my God. Oh.
They're like running away. They're like, oh, hell no.
It's one of the best feelings in the world, to be
Yeah.
honest.
Describe what it felt like.
I felt it like it for whatever reason, it went into my thoracic a lot more, and I felt like everything that was in there just basically just popped.
Got it.
Yeah.
Yeah, I mean, I just pull. I can't really aim it.
Right.
But what happens is where it's most needed, where there's most compression, is where you feel it release better.
No, it felt good. I think it got down lower than it has in the past.
Oh, really? That's because I was showing off for the camera.
Right.
I should say. I wanted to say that on the camera. You guys, all you guys that are going to come in and see me, you should say yes to getting a video. I feel like I do a better treatment for the videos because I show off for the camera.
And I make more money.
And Zach, the cameraman, makes a little extra money. All right, you ready? I want to do a little release here, and then we'll get you up. Stay relaxed. Good. There you go.
Nice.
A little pop there. Relax. Yeah,
Nice.
good. All right, let's see. It really doesn't feel too bad, but once we get back on that table, I'll make sure that it's fully released, and then we'll make a decision whether we're going to do the occipital. It does feel still pretty restricted going this way. This way is great.
Oh yeah. Butter.
I got this one on the 2 visits ago, right?
Yep.
Yeah. Okay. All right. Come on up when you're ready. Take your time. When you stand up, just tell the camera what it feels like, and if anything feels different.
You just feel a little lightheaded, I guess. You know. Just,
Sometimes some people get lightheaded.
Yeah.
Just
I feel good. I feel straighter. I feel, just like a little like euphoric.
Good. All right. Sounds like a good pull. Thank you for that.
Yeah.
Go back on that table when you're ready. Zach will follow you out. Now we're going to recheck. The first thing we're going to do is look at your posture again. And again, I hope the camera can pick it up, but you got pretty much all that torquing is not gone, but almost gone. It's very reduced compared to before. Yeah, definitely the hips and pelvis. And your heels are even now, which means this right hip came down to even with the left. Very, very level, which means for sure this had to be released a lot on that side. So let's check. Remember when I bent it up, you said it was pulling here?
Yep.
Let's bend up again. Tell me if it feels the same here or different. I'll bet money. Don't lie though.
No, there's no pull.
See that? That's awesome. So now we're going to do some more releasing in this region with what's called the drop technique, or used to call the Thompson technique because Dr. Thompson was the guy who invented it. So basically, the belly part drops, this part pops up, and when I push down on you, it goes slam. So that's what you're going to expect to feel in here. It doesn't hurt though. You've had a couple of these already. So just stay relaxed. Good. Nice. Good. Do. Theo, you want to go next? He's like, hell no. I don't do this same kind of stuff on a kid like you. It's different. You play sports? What do you play? What's your favorite sport? Cool. Yeah, you definitely gonna need me one of these days if you keep playing football. Good. Good. All right. My sport growing up was martial arts, full contact fight and stuff, and I used to go to chiropractor when I was your age. All right, let's see how well you're doing in the SI joints. Lift as high as you can. Very nice, and down. How's that feel?
Feel good.
Do this one. Okay, and down. Visually, it went up higher. How did it feel compared to before?
Felt better. Felt loosened up a little bit. Yeah.
Is there still any pulling residual?
No, I wouldn't say. I don't feel anything in my muscles. No, yeah.
So it feels pretty free?
Yeah.
You happy with how it feels?
Yeah. Feels good.
Okay, so we're happy here. Now we're going to do the lumbars. This was the pelvis, the sacroiliacs. Now we're going to do the actual lower back vertebrae. So I'm going to step around to the other side of the table. We're going to still do the drop. Just stay relaxed. Good. Nice. Good. Boom. We don't have a microphone over there. That was crunchy.
Yeah, you felt that, right?
Yeah. All those people that want to hear the cracks out there. Good. Okay. Coming up with the belly part. Now we're gonna release more in the thoracic spine, the middle back. Just stay relaxed. Good. Nice. Good. All right. Look straight up. We're going to get a little more release. Tilt. Stay loose. Good. Back in the middle. Good release on that side. Let's see if that right side, which was more jammed, needs any more. Look up again. Tilt. Yep. Got it there too. Very nice. Very nice. Okay, sir. Roll over on your back when you're ready. This might be a new move for you. I didn't do it until I went back for the second seminar. I don't know if I did it on you your last visit because I had just come back.
Yes, that's right.
So we're going to do the front of the shoulders.
Yeah, you did the last
the collarbones and the rib cage.
Yep.
Did you like that last time?
That was good, yeah.
All right, slide down a little bit. You need to line up a little bit. Okay, right there. Yep, you know. Arms out like Jesus on a crucifix. Stop flashing the audience with your belly, though. All right, so this pops up. Stay relaxed. Good. Turn this way. Now, this is the joint that connects the collarbone to the sternum or the chest plate. Good. Sternoclavicular joint. Good. Come in the middle. Now we're going to do the rib joints, but very gentle, because ribs are sensitive, and they're supposed to be sensitive because they protect our vital organs. So God made them ultra sensitive so that we protect people from messing with them. Because if you get underneath this, we're dead. If you get through the ribs, that's bad. All right, hands back up. Slide up a little bit towards your head. A little more. Okay, good. Now we're going to do a pull at the knee. Should open up and adjust the knee, maybe even hit the hip, and maybe even more in the lower back. All you got to do is just give me a floppy leg, just, whatever they call it, dead weight. Be loose and floppy. Nice. That's what I'm saying. Scoop back up. We're doing the other side. Drop it. Good. Relax. Boom. Slide back up. Jen, was the other chiropractor you went to, did he do all this stuff? No way. I would bet money. Because this is not standard chiropractic stuff. Good. Now we're going to tug at the ankle, get a little release in the ankle, maybe the arch, maybe even more up this way. Stay loose, drop it, loose. Ready to go. Oh, that was humongous. Loose. Good. All right, sit up when you're ready, face that way. He's alive. That's going good. I really didn't check the range before. Is that still pulling?
It's getting jammed a little bit, or at least there's a little bit.
Is it less than before?
It's less than before, but I think it's just the muscles are agitated.
Honestly, bro, there is a little something in here. Let me see. It really doesn't feel too jammed here.
Yeah.
But the fact that it's still pulling, I think it's that, what's called the levator scapula muscle. Right. So I'm going to do a little muscle work here to release it. This is where it attaches to the scapula. Is that sore?
Yeah. But it feels good.
It's clicking.
Yeah.
Yeah.
Yeah, that area is like...
Feel how that's like click, click, click. Yeah, there's definitely some adhesions going on in that area. Good. If it's too much, let me know.
Nah, it feels good. It feels like you need...
Yeah. A little bit up in this way. Now turn. Is that any different?
That feels much better.
Good. Yeah. Now how about, is that nice and smooth and fluid?
Yeah, that feels good.
All right, bro. All right, we're going to leave you. I mean, I wanted to showcase an occipital lift, but you don't need it.
Nah, it feels good.
Yeah, you don't
I
need
think
it.
it's more muscle.
It's muscular.
Yeah.
It's coming from this muscle
Yeah.
rather than locked up here.
Yeah.
Okay, so we're going to finish today with the shoulder adjustment, elbows, wrists, fingers, and we're going to be done with you. So start here, bend in front. I got to give you a hug. Remember this one?
Yeah.
Stay relaxed. Relax it, relax it. Good. Give me this one. Loose as goose. Loose. Let it go. Good. Coming around. A little bit in the elbow. Everybody, well, not everybody, but a lot of people are freaky about their elbows, but it's gentle. Good. Release. Floppy wrist. Good.
Oh, yeah.
And coming up too. We got it on the way down and on the way up.
That's my texting.
What's the matter, Jed? Making faces over there. Drop it. Loose. Loose. Good. Relax. Loose. Loose. Good. Boom!
Nice.
We're going crazy today. One up, one down. Good. Done.
Thank you very much.
My pleasure. You want to say something?
If you guys are feeling like you're jammed up or you need to get treated, I highly recommend come see Dr. Herman.
Yeah, I appreciate that. What he said. Listen, if you need some of this, if you're watching it and you're saying to yourself, wow, maybe that could help me, maybe that looks like it's something I need, well, go with your instinct, go with your gut, and if it feels right and you want to inquire about more information or book an appointment, the best way to do it is go to my website, which is retrochiropractic.com, because my office is in Retro Chiropractic of Edison, New Jersey, so that's why we call it Retro. There's a book now link there. Just put your information in. It goes to my assistant. He'll reach back out to you and you guys work it out. And hopefully you come in. And if you do, I promise you, I will do my very best from my heart to help you out and give you the best relief and whatever else you're looking for. So also, I'm building my YouTube channel. It's Guru Chiropractor on YouTube. Subscribe. Come to YouTube, check it out. Subscribe to my channel, like and comment. And that'll boost it up so we can get the word out about this kind of chiropractic because it helps a lot of people and there's a lot of people out there that don't know about it. I'm also Instagram, Facebook, and TikTok. I'm also Guru Chiropractor. You could check me out there too. And this is the Guru Chiropractor and Big Mike signing off. Peace and love. Out.